I'm Srinivas.
Hi Srinivas, nice to meet you.
Thank you.
Yeah. You hit G for me? Here, let me get it. There we go. Down, all the way down. And then up.
My company, Ensure Health, provides prescription management, personal prescription management.
Uh-huh.
When was the last time you changed your doctor to come up with the medication history?
So when was the last time I had
You changed your doctor.
Uh-huh. I changed my doctor.
Doctor
Yeah.
had to come up with your medication history.
Oh, yeah. So every time you change your doctor, you have to come up. Yeah. It's a litany of questions, you're right.
Yeah. Wouldn't you like to have your own medication history that can be portable wherever you go?
So it's something that I would take to the different doctors.
Yeah.
And this is kind of the list of medications I've been on.
Yeah.
All right.
Only by you would like to have.
Sure. That's it. That's an interesting proposition. Can you tell me more?
We create long-term prescription tracking record that you can take to new doctor or pharmacy wherever you go. Is that something interesting to you?
Yeah, possibly. It's interesting to me as a physician, more so honestly than as a patient. The idea of having something that's kind of, a lot of times when patients come into my office, they don't remember the medications they've been on. And they'll start with, oh, the orange pill, it never worked for me, and I don't know which one the orange pill is. So yeah, no, there sounds something interesting there. But go on.
Great.
Okay.
Do you know anybody at insurance companies that would like to discuss with us?
So I do know some people in insurance companies, but you got to tell me a little bit more about like what's the benefit of this thing? I mean, I can see the kind of. Yeah, it's nice to makes things a little more convenient and whatnot. But, so, what's the problem you think you're working on?
We are trying to help the patients to own the prescriptions so that they can maintain the medication compliance. So the prescriptions will be patient-centric. Who owns the prescriptions that can be shared with the pharmacies or the doctors whenever and wherever they want to share with.
Okay, so do you think the lack of ownership is a problem with compliance?
Yes. So the fragmented systems, like having different pharmacies, different doctors, along with the different insurance companies, that is creating the medication compliance issue, where the patients are, around 20% of the patients are missing to fill the prescriptions.
So, okay, so yeah, I was going to ask you, where did you get the idea, the link between compliance and this kind of prescription loss, or whatever what would you call it?
The fundamental thing is like the compliance needs filling up the medication, taking the intake process, and getting monitored to mitigate the disease. Right?
Okay.
So where the initial first stage is getting the medication from the pharmacist itself is missing for the 20% of the patients. It is missing because of this, because of affordability and the cumbersome process at the pharmacies and the miscommunication or the lack of communication with the physicians.
20% of prescriptions that are written aren't filled, or
they're filled. Yes,
they're not filled because
there are around 4.5 billion prescriptions are issued every year. Out of the 20% prescriptions are not at all filled.
And you think that's because?
That's because of not having the affordability and availability nearby shops. And the other issue that what I see is the patients, once they give some pharmacy address, if they are away from it, they are not able to go to the particular pharmacy, and to change that prescription is a big process, getting back to the doctor, asking to transfer.
Have you talked to people that felt like that was the issue that they felt? Have you talked to some patients who were like, if I just had my prescriptions, that would make it easier? That's where you came up with this?
Yes, I had a talk with the patients, physicians as well, what the panic situation they go through and to change, or if they forgot and they headed for the vacations, what the problem they face to get the medication or the missing the medication that could be end up the patients in emergency or urgent care.
Okay. That'd be some really interesting data to get, like, you know, of the people, of this 20%, because that's a big number, right?
Yeah.
20% of 4.5 billion is nearly a billion, right? Scripts that are not being filled. So someone's losing out and someone's not getting adequate care, and that's a big ball being dropped. So getting numbers, like a little bit harder data around, well, this percentage of that 20% is because there's this kind of like drop of information. So the thing that I see typically is that when there's an issue with compliance, it's really around, you know, patients don't believe in that, they don't necessarily buy off that that medication is going to do something for them. So it sits slightly differently for me. But so I need a little bit more proof from you.
Yeah, sure. So like there are like 50% of the patients are not compliant to the medication in US, and out of the 50% of the population in US are.
I think we're getting to our floor. Bing! There it is, our floor. So nice to meet you. I think you're working on an interesting problem. Compliance is something that everyone worries about, and some more digging would be great. So one thing I can do, I can share the room so you can, so you're not running around all over the shots of all
Okay. We have time for one question. Anyone have a question? Yes. Okay.
If I was an insurer or PBM, could you make sure that the patient is filling their prescription at the lowest cost pharmacy?
Yeah, man, like it depends on like how we are going to manage the whole thing. We are working with the PBMs as well as it's a patient-centric thing that would be managed from the perspective of patient, wherever he can connect and get the best possible, affordable and available nearby him, wherever and whenever he wants.
Okay. Wonderful.